The case study we're presenting today is on a patient with multiple restorations. Our patient is a 62-year-old adult Caucasian female with no allergies. Her blood pressure came in at 125/78, which puts her in the pre-hypertensive state. All other vitals were within normal limits. She also had a hysterectomy 12 years ago and was diagnosed with type 2 diabetes and hypertension 2 years after that. Her most recent HbA1c value was 6%, and the medication she is taking include 8.5 milligrams of Celar for her chronic hypertension. It has no effects on anesthetic or bleeding but causes xerostomia and may cause gingival hyperplasia. She is also taking 850 milligrams of glucophage for her diabetes. There are no effects on anesthetic or bleeding but may cause a taste disorder, and she should be scheduled in the morning to reduce the chance of stress-induced hypoglycemia. She is also taking 81 milligrams of aspirin, which has no effects on anesthetics but can affect homeostasis and inhibits platelet aggregation. This classifies her as ASA2. Her chief complaint was that her bottom teeth seemed to be getting longer and her gums seemed to be disappearing. During her extraoral exam, her submandibular and submental lymph nodes felt enlarged when palpated. All other extraoral and intraoral findings were within normal limits. She has class 2 occlusion on her canines and her molars were unclassifiable. She also has a posterior crossbite. She has generalized pale pink and smooth gingiva with rolled borders. Blunted interdental papilla is also noted in generalized areas. There is minimal BOP present on teeth numbers 6, 13, 22, 23, 29, 30, and 31. She has a class 1 furcation on number 19 and a class 3 furcation on number 30. We found an 8 mm pocket on the distal lingual surface of number 30 and a 7 mm pocket on the mesial lingual surface of number 31. There is also generalized cal ranging from 2 to 4 mm on both arches. There is barely discernible tooth movement, which puts her in the plus mobility category. Her calculus code was a 3 light medium and has lost more than 4 teeth due to periodontitis. This makes her periodontal classification stage 3 periodontitis with grade B. The images included were a FMX and intraoral images of the right side, full direct, and mandibular occlusal. From the full mouth series, we can see that tooth 30 appears with overhanging margins, which may cause recurrent decay and vertical bone loss on the distal with an infrabony pocket. There is also possible recurrent decay for number 29. She is missing teeth numbers 1, 3, 14 to 18, 20, and 32. Her restorations include amalgam on numbers 2, 4, 5, 10, 12, and 30, and a bridge connected to teeth 19 and 21. She also has a composite filling on number 29 and a PFM crown on teeth numbers 13 and 31. We can see generalized recession throughout the oral cavity in the intraoral images. Our proposed treatment plan will consist of continuing the 3-month periodontal maintenance. We will stop the use of a hard manual toothbrush and instead switch to a soft or extra soft electric toothbrush. We will transition into using interdental brushes instead of string floss. We will switch into using non-alcohol based mouth rinse including fluoride and using a tongue cleaner to help with bad breath, also known as halitosis, and increase her water fluid intake. The 8 human needs are being addressed, so we will begin with protection from health risks, freedom from fear and stress, freedom from pain, wholesome facial image, skin and mucous membrane integrity of the head and neck, biologically sound and functional dentition, conceptualization and problem solving, responsibility for oral health. All of these will be addressed by maintaining her proper oral care that is needed and referring her to the general dentist, making sure all her pending restorations will be taken care of. Oral hygiene instruction. Our first item is the electric toothbrush with a round head and pressure sensor. When properly using an electric toothbrush, it will not cause gum recession and will be more effective than a manual toothbrush in removing biofilm, and the toothbrushing method we will use is a Stillman method. So the bristles are angled towards the root of the tooth. The filaments are placed partially on the cervical portion of the teeth and on the gingiva using short back and forth strokes. Our second item is fluoride dentifrice. So it is essential for our patient because she has recurring decay and multiple restorations in her oral cavity. The product helps fight against possible caries, remineralize enamel, and reach interproximal surfaces and deep grooves of the teeth. This also helps stop further gum recession, decrease hypersensitivity, and xerostomia. Our patient is diabetic, so this is very beneficial for her. Third item we are introducing is a non-alcohol based mouth rinse. This helps combat xerostomia, also known as dry mouth, and improve her bad breath, also known as halitosis. The fourth item we are introducing are interdental brushes. Our patient has a difficulty using string floss, so interdental brushes would be the ideal way to clean interproximal spaces and help keep her multiple restorations plaque-free. They can also help keep implants clean and reduce bacteria in the places where the patient is missing teeth. The research shows how effective an interdental brushes with toothbrushing has a better impact over toothbrushing alone in removing plaque and treating gingivitis. Interdental brushes come in a variety of sizes, and it's important to use the appropriate size for the appropriate areas.
After completing the assessment, our patient's perio status is stage 3 with grade B. Her systemic conditions classify her as ASA2. There was generalized recession on the intraoral images, and the x-ray showed generalized vertical bone loss with an infrabony pocket on the distal of number 30, which appears to be the cause of tenderness on the right side. Her gingival tissue is pale and shows no signs of erythema, but has rolled borders. Her bleeding index was 12%, and the plaque index was 15%. Upon reviewing the patient's oral hygiene home care, the following adjustments were recommended to present an overall reduction of plaque and periodontal disease. The Wiley Dental Hygiene article reports their case study findings on how interdental brushes effectively reduce gingival inflammation, remove plaque, and improve periodontitis as compared to brushing alone or using a manual toothbrush. Interdental brushes perform a better result than floss for periodontal patients because the design of the brush allows to clean more interproximally for people whom experience clinical attachment loss, where floss is cleaning much less surface area due to absent interdental papilla. Our patient does not prefer to use floss because she finds it difficult. As the patient reports her teeth looking longer, this is evidently showing how her periodontal disease is progressing faster due to her systemic diseases. Findings that show the following confirms gum disease in combination with diabetes such as bleeding gums, halitosis, longer looking teeth, and an increase of space between teeth. Although manual toothbrushing can be effective, utilizing an electric toothbrush has proven to be the best compared to a manual toothbrush. An electric toothbrush aids in maintaining accurate brushing pressure, adequate brushing time, and proper oscillating motions. In conclusion, our research and recommended treatment plan aims to improve a successful treatment outcome for our patient. What we found interesting were the effects of how her systemic conditions, along with her medication, mouth rinse, toothbrush, and other factors like not flossing daily, contributed to the patient's periodontal disease and progression. Meanwhile, the patient considered herself in great health and felt that she had taken good care of her teeth, yet she lost a few teeth due to periodontal disease. We immediately knew that the patient had the wrong oral hygiene regimen because she was using the wrong type of toothbrush and mouthwash for her specific needs. She may have thought that these were beneficial or contributing to her good care, but it was quite the opposite. Her teeth were screaming for help.